Diseases or illnesses?
I think the disease is the correct form.
Fish diseases.
Yes, fish disease.
Okay. As you probably realized from the title of this video, we're not talking about merry subjects here, because the topic today is fish diseases. And today's guest is none other than Márton Hoicsi, who is a Hungarian fish veterinarian. I can't even say your profession. Yeah. Try to say aquascaper to me. Okay, but he has helped us a lot with previous fish diseases, illnesses, sickness, and he's a really good guy, and he specializes in fish. How many in Hungary or in Europe that you know in this business of fish doctors? Do you know many people like that?
Yes, so Europe is huge. There are a lot of fish vets, but in Hungary, I think
you're the only one.
No, not really. There are three fish
Three
vets.
guys.
Yeah.
Okay. So I hope that you guys will learn a lot from Márton today. Welcome to the beautiful world of aquascaping. Let me tell you that the most important thing that you can do for the health of the fish, and I think that Márton will subscribe to this point of view, is that you will actually take care of the circumstances of the fish. We've been talking about the regular way of maintaining a healthy ecosystem in the aquarium a lot in the previous videos. You need strong filtration. You need lots of plants to provide enough oxygen. You have to take care of the temperature, and you have to give them enough space so you do not overpopulate the tanks. And this is why we here at Green Aqua usually do not have as many problems as regular old school aquarium hobbyists, because the circumstances in the showroom tanks are much better. We have strong filtration, we change the water regularly, we take care of the water parameters, we don't have ammonia spikes, which you know can increase the stress levels of the fish. Right, but before we move on, let me tell you a story about an old acquaintance of mine who is a very good investor, Hungarian investor, and he posted on social media the following. He was talking about healthcare, and he was going into the semantics of this word, health care. Actually, healthcare should be disease care, because you guys are in the business of dealing with diseases. So when a fish gets to you, they already have a problem. But we, hobbyists, should be in the business of the real healthcare, which is for humans eating well, working out, sleeping enough, and not stressing yourself to death, right? So if you have these four, you're gonna be okay. So imagine the same thing for your fish, except they're swimming in their own pee and excrement, right? So you have additional problems there.
Yeah.
So you need to take care a lot more about their environment than you would actually take care of your own human environment, right?
Yes, you are correct.
Okay, so with that said, let's start to talk a little bit about diseases and what's your point? So what do you think that is needed to form a good ecosystem?
So you told a lot of things, and you were right. Everything starts with the husbandry. The husbandry is how you keep your fish, what are the filtration parameters.
Not being a good husband. It has nothing to do with being a husband, right?
And also with the feeding. If you have a bad fish food,
okay,
it's a big problem. Everything starts with the aquarium, as in your business. So if you have enough big tank, enough big aquarium with a good water, good plants, good soil, and good filtration, that's the point. Point for the welfare and also for the prevention. We don't would like to reach the diseases. We would like to stop before. The aquarium should be enough big, and the temperature of the water should be optimal for the fish. For example, if you have a betta, you should have a higher temperature of the water, or if you have a cold water fish, because there are a lot of cold water aquarium also, then the water should be colder.
What happens if the circumstances like the temperature or the aquarium size are not ideal? What happens then?
It's a stress for the fish, and if the stress starts, after this disease will also come.
As you can see there, the aquarium size, the quality of the fish food, and also the filtration are very important. You didn't talk about lighting. Can lighting stress out the fish?
Yes, if you have too much light or the lighting hours is too much,
Okay.
then it's a problem.
So what do you think that like fish health-wise, what would be the ideal?
The optimal is what they have in the nature.
Like 12 hours?
I usually recommend that check where your fish is living. For example, in Asia or in South America.
Like you've got good lights and you can program those lights to
Yeah.
actually mimic the
Yeah.
local conditions.
Yeah, that's the best.
I've seen apps like that. That's the future, right?
Yeah, of course.
If it's raining there, in that bend of that river,
Yeah,
then
it's
you're
connected
gonna
with the
have,
weather forecast.
we have the Oase watering for the garden, internal garden, and that is actually connected to the weather forecast. So you think that lighting like 8 hours, what we recommend, is good for the fish health.
Yes, it is.
And what would you say to those who would be questioning the very strong lighting of these new LED lights that we have above the aquariums? Would that stress the fish too much, or they can get used to it?
They can use it. It's okay. The only important thing that the fish needs some quiet and dark hours.
So they can have a rest?
Yes.
Like something that I talked about
Yeah,
at the
yeah,
beginning
yeah,
of
yeah.
this video. You need 8 hours of sleep, 6 to 8 hours of sleep.
Yeah, the fish
If you don't get it, you're gonna be...
the fish needs less, but yeah, you are right.
How long do they need?
At least 2-3 hours.
Oh, really?
If you have a tank with full of plants and you have to, for example, 10 or more lightning hours, then at least 2, but problems can come after this. Usually 6, 7, 8, that's normal for fish.
Okay, and before we move on, I just want to tell you guys that that those tanks that do not have enough hiding spaces, like open minimalist Iwagumi style tanks that have only a couple of rocks and some grass at the bottom, and you have a big shoal of fish swimming above it, those conditions would not be stressful for most fish. There are some fish which would be stressed out under these conditions, but our own experience tells us that these minimalist Iwagumi conditions are perfect for fish. And how do I know that? I know that because none of those fish in the Green Aqua Gallery became stressed or sick after a couple of weeks or months, even years staying in our tanks.
I agree with you. And after the tanks, we should speak about the filtration a little bit.
Okay.
So I think the problems, the diseases are coming from if you have problem with the tank or with the filtration. 80-90% of the problem coming from the bad husbandry. So the fish excrete ammonia. The ammonia will be
Decomposed.
nitrate. Yeah,
into
and
nitrates.
after that,
The plants will uptake
Yes.
it. It's a plant nutrient.
but the ammonia and the nitrate can cause problems. If the levels go high and higher, then it will be a big problem.
And that's why you need good filtration, and
Yes.
that's why you need also good water changes. Like that's why we do 50% water changes, because we need to reproduce the natural environment, and the natural environment does not have a lot of ammonia.
In this situation, you have a small closed system, and only the filtration can help. If the ammonia level will go higher than the normal, it can burn the gills of the fish.
Oh, really?
Yes, it can cause gill damage.
And if you have gill damage, then you are not able to uptake, as a fish, you are not able to uptake the
Oxygen?
The oxygen. So
Yes.
your system will be oxygen deprived, which would be probably...
Yeah, you will see the sign that it's an oxygen level problem. But if you check, if you have an instrument that you can check the level of the oxygen, you will see that
you
it's
have
normal.
you have water tests that
Yeah,
and
yeah,
you
yeah.
can actually check
Then
the oxygen
you
levels.
check it on in the aquarium, And you see, it's normal.
So
Why
what's
is
the
it?
problem?
What's the problem? And if they check the other water parameter, then you will see the ammonia level, and the others, it's high. And this is the problem then.
Okay, and going back to stress, some people have commented below one of our videos that we are stressing the fish too much while we're doing maintenance. That 40 minutes, 1 hour until I trim the tank and I chase the fish away with me, you know, trimming the plants and taking out stuff and rearranging stuff. What do you think about that level of stress?
I think it's not a problem. The problem will start if this will be stress, which is not an end.
Oh, like an endless stress.
Yes,
Like
it's a big problem.
A bad husband or a bad wife.
Yeah.
If you have one fight at home, that's okay. But if you have a fight every day for a year, you're gonna get sick.
Yeah, and
Or
also
divorce.
and also it's the same with shrimps.
I never knew, because I thought that shrimp, you know, they're just there and they're the last ones they're still, but you know, if you have problems, shrimp can die as well. I mean,
Of course.
they're so fragile, the small
Yeah.
creatures.
And the shrimps you can call indicator species because they are really sensitive. So if you see that something is wrong with the shrimps, you should check the water because you will have problem with the fish maybe.
When he says something is wrong, he means they die. Some of them dies.
Yeah.
Because shrimp, you don't see anything on shrimp except certain things that we're going to talk about later. But usually you just walk in there. What happened to that shrimp? This is husbandry.
Yeah. And there,
Who are those guys?
can I use the
Those
pointer?
look sexy. Yeah, we have a pointer here.
We have this pointer,
Red Moor wood pointer.
the best one that I ever used. And this part is the diseases, viruses, bacteria, parasites, and other fungus, for example.
yeah.
But this is a small percent of the problem.
So, and where are these guys coming from?
These guys coming from the new animals.
Okay,
For
so if
example.
you have an aquarium at home and everybody's nice and healthy, the filtration is working well, you would think that you have a stable ecosystem, and you go to your local fish shop and you buy one shrimp.
Yeah, for example, one or more. And maybe you see nothing in the shop because there is a normal habitat, everything is okay, they are fine, welfare, everything is okay. But the transportation is a stressful situation, and the immune system will go lower levels.
Right.
And then the bacteria, the viruses, and the parasites can spread.
attack.
Yeah, you will see higher number of the parasites, for example.
So what you're saying is that you can actually buy a healthy animal and bring it home, and then immune system goes down and it can get unhealthy and get something, and that it can transmit that to the other fish, right?
Yes.
So what can you do against that?
There is a solution. Sorry, there are more solutions.
Okay.
First, if you have a quarantine tank. So you have your main tank, very nice
But
tank.
don't forget the filtration.
Yeah.
The filtration is not included in the picture. That doesn't mean that you can do that without, because the doctor said so.
It's just a drawing. So you have a beautiful main tank, rocks, plants, everything.
Okay.
A good population of fish, shrimps.
Do you have an aquarium at home?
Yes, of course.
All right. Is it a planted tank?
Yes, with shrimps. And near this, you have to keep a quarantine tank. It's a minimum aquarium with filtration, with aeration, but nothing else. No soil, no rocks, no plants, just the minimum. Or if you have some rocks or plants in, after the quarantine time, you have to throw away.
Oh, I see.
Yeah.
But you cannot set up that tank just before you bring in the fish, because
Yes.
then it's going to be a new aquarium and the filter is not going to be cycled. So ideally you would want a tank that is running all the time.
Not really. For example, you can use the water from the main tank, from the main aquarium. For example, when you would like to do a water change.
And what about the filtration? The filter is not running, there's no bacteria living in the filter helping you with the ammonia.
You have to make plans before you buy a new fish or new shrimp. I think if you go in a shop, oh, it's nice and I will buy it and put into the main tank, maybe this will be the biggest problem.
I'm pretty sure that the marine guys, those who have a saltwater aquarium were doing this for a long time, because if you bring in very expensive corals and stuff, then you would, want not to contaminate everything with something that you bring in. But right now, I think that in the freshwater aquarium hobby, nobody does that. So I only know maybe 1 or 2 people who have quarantine tanks at home. But I understand why it's needed, so I highly recommend to everybody to have them.
I know that this is not an easy situation, but if you buy a new fish or shrimp or everything else, and if you put this animal into the quarantine aquarium for 1 or 2 weeks long, you can prevent your main aquarium from a lot of diseases.
Absolutely. Okay, while we're there, I just remembered that we have an old problem. What we recommended until now to our viewers is that when you bring home the fish, you can easily use the water that you brought the fish with in your tank, because Lori, our fish expert, who was kind enough to actually prepare me for this interview, for this video, has told me that there's no bacteria in the water that is not already on the fish. So the water itself is not a threat to the aquarium.
I totally agree with this. So these bacteria, what we are talking about, these are obligate pathogen. So this means that they are everywhere, in the water, on the fish.
I love doctors, they obligate pathogens. The way that you guys speak, I feel small. I'm gonna bring down the chair down here. It's like
Yeah,
Tommy Master.
So everywhere in the aquarium or in the nature. But if you don't have any primary problem, like a situation with stress, or injury, then they are normal bacteria in the aquarium. If there's a stressful situation, or after the transport you will see, for example, a small wound, then it's an open gate for the bacteria, and they can go in and cause a disease there. Oh, by the way, so they are not obligate, they are facultative pathogen bacteria. I made a mistake, sorry.
You confuse us even more. This is why our fish expert Lori says that some of the diseases that we see at Green Aqua are not coming from the gallery fish, from the show tanks that we have here, but they're coming from the fish room. So when new fish arrive, many fish arrive from the wholesalers to Green Aqua, that's when we have the problems, because that's when the transportation and the change in circumstances happens. By the time that it gets to the customers, we already treated the disease. If we found any, the fish have already settled in, they feel better, no stress. They still can have stress from bringing them from the fish room to your home, but the most diseases that we see, it's actually in the fish room, and only at the beginning.
Yes.
And then if you give them good food, their health is going to be better, their immune system will be stronger. Like, eat your vegetable, guys.
Yeah, so these special foods are full with vitamins and other stuff, and if you have a good quality food, then it's the best for the animals.
Is that a stingray?
Yeah, it's a freshwater stingray, a Potamotrigon.
What are you doing with it?
I am doing a pregnancy ultrasound there.
All right, look at this guy. Can you give birth to a fish?
Yes, of course. So
All right.
these animals are really, really interesting. They're giving birth to live small rays. So they have uterus, like in mammals.
Oh, wow.
Yeah, and the small rays develop there.
Well, before we move on, Marton is not only taking care of the aquarium fish, but he's also a very, very good koi fish expert and fishing pond expert. You go regularly to see carp and other fishing spots in Hungary, so you know quite a lot about other types of fish.
Yeah, as you said, I am working also with aquaculture guys, aquaculture farmers, and also hobby aquarists, and also help to labs, which are the universities, for example, zebrafish labs.
All right.
So I am everywhere.
And you're also giving lectures, as I heard,
Yeah.
at universities?
Yeah.
All right. You're very lucky to have Marton here with you. Okay,
you.
so let's go back to the stingray. How many fry can this guy have?
The maximum, what I saw, it was 20.
20. All right.
Yeah, but it was a huge female. So
All right, I see.
usually when they start, they are not so big, the females, and usually it's around 10. That's the normal, 10, 15. So, but if you have a problem with your fish, I think the first step that you have called a fish vet, because thanks, because if you start a treatment without the diagnose,
We're gonna tell you guys at the end of this video where you can reach him, and we also list his contact details in the description.
yeah, so if you start the treatment without correct diagnose, maybe you will do a bigger problem. For example, there is a sick fish with not special signs, and you will put some blue stuff, some green stuff in the aquarium. Oh, there is a yellow one also, because the colors work.
That's gonna further stress out the fish probably.
Yeah, but if you not choose the correct treatment, the parasite will be there. And the time is running. And for example, you treat the animal 1-2 weeks long and nothing happened, and after that call me, oh doc, there is a problem, please help me. It's maybe too late, yeah. Because we are not wizards, we cannot do miracles after 2 weeks. So the best, if you have any problem, if you see the signs of a disease or any problem, that just call a vet. Maybe there is nothing, but if you have a very expensive fish or shrimp in your tank, then maybe after the call you will know the diagnose, you will know how can you treat this, or maybe you should just do a water change and everything solved.
Let me ask you, are most fish diseases treatable
Not all, but most of them.
if you catch them
Yeah, in time.
in time?
Yeah, but what are we doing, fish vets? So I can show you.
Yeah, what are you doing?
I can show you that, as I told you, the water quality is really, really important. So first we check the aquarium. First we start with the filtration, check the water quality. You can see it's a simple water test. We check the oxygen level, we check the temperature, the pH.
By the way, you guys, you can do this at home. There are tests available at Green Aqua if you live in the EU. We can ship those tests to you. We usually recommend to test for ammonia, oxygen, chlorine levels maybe. If you have tap water that is fully with chlorine and you did not use dechlorinator, we forgot to mention when we were talking about the gills that you can have problems with the chlorine, because that would also act like ammonia would, and it would hurt the gills.
Can I advise 2 other parameters?
Yeah.
Nitrate also.
Well, nitrate is not, well, when an aquarium is cycled, nitrate is not a problem, because usually when the filtration is okay, it's like...
If you have a good filtration. If not, or is it overpopulated?
So you
tank?
start always by asking about the filtration.
Yes.
By the way, for algae, we do the same. If you see algae, okay, what's your filtration? That's the first question.
Yeah. Filtration, the water, and the food quality also. What are the fish eating? Maybe it's also a problem. Let's have a bad quality food. After that, we start to do a physical examination on the fish. Check the habit. How is it moving? Is it rubbing or not? How look like the skin? Is it normal mucus or too much? Maybe it's also a problem. Usually we do a skin scraping, and this we will put into the microscope.
Oh, actually, you did this with the koi fish at Green Aqua. So we have a couple of images that you guys can see now, and Marton was invited to us first time. That's how I met him, because we had one koi fish that had a little infection near the tail. We saw that it was rubbing and we didn't know what the problem was. As you said, it was living like outside the flock. He was like hiding in a corner in the pond, and we saw that there's something wrong, because the behavior changed from one day to another, and that's how we knew that there's a problem with that fish. So you came in, you brought that great microscope that you see on the other side of the studio there. That's your very precious microscope, and you actually took a sample from the gills?
From the gills and from the skin also. Yeah, so it's just a small scraping. And you can see a lot of things, parasites, maybe bacteria also.
I don't want to do any spoilers, but you actually helped us with curing that fish. You applied 2 types of medication.
It was a skin fluke. This was the primary problem. And after, the skin fluke irritating the skin, and usually it's itchy for the fish. And they will rub themselves.
They will start scratching.
Yeah, and there will be a wound because of the scratching.
And because of the wound, open gate,
For the bacteria. Yeah.
So we had 2 problems. So
yeah.
usually you don't, when you see some problems, those problems tend to escalate.
You should cure the first problem, the primary, the skin flukes, and after you can cure the bacterial infection also with antibiotic.
Okay. Well, thank you for helping us in
You're
that.
welcome.
And that was the parenthesis. Sorry, move on.
So yeah, we talk about the skin scraping. You can see some really beautiful parasites. For me, for the owners, maybe not, but they are really beautiful. For example, this skin fluke, what you have.
Wow, I love those images.
Yeah.
I could appreciate it besides infecting our beautiful and precious fish.
They look really interesting and totally different from other flukes. So. But you can see other parasites like ciliates and other worms and bacteria, as I told you. And after that, if you have a bacteria infection, you can do antibiogram. So you isolate the bacteria from the wound, you spread on a plate.
Oh yeah.
And
The
put
Petri
some
plate.
and put some antibiotic there, and you will see which is the most effective.
Oh, I see.
Yeah, because the antibiotic resistance is a really big problem.
Yeah,
Everywhere
it is.
in the aquaculture and in the aquarist also. Yeah, because in the past the hobbyists, the aquarists can buy
Whatever antibiotics they want,
And
and they just apply it, and then it's
Yeah.
working. Yeah. Nowadays it's not. Yeah, we tried that actually. We used some crushed antibiotics and we put it in the tank and it didn't help. You need to be there in person in order to take these samples.
Yes,
so
yes,
you
yes.
guys cannot send samples to him to check.
And after that, if you need and if you have a big tank with a lot of fish, sometimes we should do some dissection, so necropsies, and we can do histopathological signs and check what is the problem. So
Which is also good because there are other fish in the tank, so you would want to
Yeah.
know what the problem was before.
yes.
We have a shrimp here.
Yes,
What's with
this?
the hair?
Oh, where is the pointer? I should
Get the
use
pointer.
again. Yeah. So this hairy stuff, these are Scuteriella worms. If you have only few, it's not a problem, but they will spread. You will have more, and they can cause a big problem because they can go in to the gills of the shrimp.
And you have the same oxygen problem.
Yeah, the same oxygen problem, like
Right.
others. Yeah, and in this shrimp, not the only problem.
Oh, there's another one.
Yes, here you can see this yellowish greenish stuff.
Algae.
No.
No?
Not that algae that you have in a tank. This is a parasitic algae.
Oh, there's something like that.
Yes, the common name it's green fungus, but it's not a fungus. It's an algae which can infect shrimps. So this algae can go into the body of the shrimp. So for example, you go into the shop, you see the really beautiful shrimps, you buy 10. Then you will go home, put into the main tank where you also already have some shrimps. You will bring in the worms and also the Cladogonium.
Can that transmit between 2 shrimp?
Yes.
Even if the second guy is completely healthy and the circumstances are completely okay?
No, there needs some...
You need some problems.
Yes.
What happens if you have a perfectly sound ecosystem and then you bring in one sick fish or shrimp? What happens then? It will probably not infect the others because if the others are strong.
It's depending on the problem. If it's a parasite, the parasite will go to the other fish because normally if you go to a river and catch a fish and you do a skin scraping, you will find parasites, but maybe 1 or 2. It's normal. We also have some parasites and it's normal until we get any illness. It's the same in the tank. So if you put a sick fish and it's a parasitic infection, then the other will also get. If it's a bacterial infection, which is an obligate pathogen, if the others are okay and the immune system is working well, then it will cause nothing.
Fine. Okay.
Yes, but you don't know until the examination.
In my home tank, I had some planaria and some leech, and I observed that these leech can attack the shrimp. Did you see that before?
Yes, usually the planaria not, but leeches sometimes can. So, and this you get with the plants.
The only exception would be the lab plants, guys, because if you have lab plants, those are coming from sterile conditions from the laboratory, so you will not get anything from those for sure. But for the submersed or immersed plants that you can buy in pots, you have the risk. Let's not cause any panic here.
Yeah.
Usually you don't do that. So normally plants that you get from all the bigger vendors are clean. So usually you don't have any pests in that, but you have the chance of getting it.
But there is a solution. There are medicines which will kill the planaria or the leeches, and
You just have to bath the plants in that for a
Yes,
couple of
yes, yes,
minutes,
yes, yes.
hours. How long?
it's depending what kind of parasite you have there, because these medicines will work only the larvae or the adults. If there is a egg,
The eggs will not be killed by
Yes.
these medicines.
yes.
Oh, I see. But what happens if like you have eggs on the plants?
You can treat the aquarium also. You can treat the water. So you put the medicine into the water, and that will kill the parasites.
Okay, again, I would not think that it is practical to do such things, so I would just bring in the plants and plant them. And again, by our experience, stress and bad conditions are two problems that are mostly happening with fish diseases. We never, for 10 plus years, we never have huge problems, huge infections in our gallery tanks. I didn't see that. We didn't lose 10 fish. We didn't. They live like crazy. Maybe they jump out sometimes, and that's what we're talking about when we have a video about fish jumping, and that's not a disease, but it's something that can kill the fish. So that is also very much connected to the general biological system that you have in there, because if the biology is not good, they will start itching, they will start behaving differently, they will start to jump.
Yes.
If they have parasites, they tend to jump more, right?
Yes, correct. So it's also a sign of a disease if they are jumping out.
All right, let's move on with the images of fish diseases that you guys have sent us. And again, thanks for your cooperation. As I said before, we don't have many sick fish at Green Aqua, so we didn't have enough images. Martin here is going to help us with identifying what kind of problems we see in our aquariums with our fish. And let's go on case by case and see what you can make out of all these images that the guys were kind enough to send us, right?
Yeah.
Okay, so
But first of all, I should tell you that it's not so easy to diagnose after a picture. So usually we aquatic vets need more and more information about the water and everything. I can just give a differential diagnose, and I can tell you what could be this.
okay, so this is like a first try.
Yes, but
It's like a radiologist.
yeah, but for the proper diagnose, we need more and more examinations.
This guppy was sent in by Joel. Thank you. He has a bump on the tail fin and he has no noticeable difficulty in swimming.
The picture is not the best, but you can see this bump front of the fins, and it could be a papilloma. It's a kind of tumor. Viruses and a trauma can also cause. Usually, it can not cause the death of the fish.
Okay.
It's just there, it can grow. If it's growing very rapidly, it could be another type of tumors, malignant tumors, but we can remove it. If the aquarists want, then we will
You can
remove.
perform fish surgery.
Yeah, I am doing fish surgeries.
Even on small fish like
Yes,
this?
of course.
No problem.
Yeah,
Size is not
first
a
step
problem.
is the anesthesia and the analgesia, and after, fish is sleeping, and I just remove the papilloma.
Okay, so without any further possibility to diagnose this, what would you recommend the owner of this fish to do?
Nothing.
Take care of the
Yeah.
general health.
Yes, yes, yes. With good husbandry, good water quality, the best food, and that's all.
Next one is Sam has sent us the pearl danio, celestial pearl danio. Loss of appetite, frequent hiding, difficulty in swimming, white patches on body, extremely sunken belly, deformed curved spine in later stages of illness. Oh my God.
It's not so easy because we also know nothing about the other things, but it could be an aquarium with a full of stress. It could be a stressful situation for the fish. It could be also the bad quality food because, for example, if this fish has a vitamin deficiency, like vitamin C deficiency, it can cause curved spines.
And why would the fish have vitamin C deficiency? From what?
Bad nutrition. If it's not good quality fish food, then it can cause this.
Okay, so the next picture came from Nikki. The rosy barb, the longfin rosy barb, has a couple of problems. Bloating. She thinks that this fish is pregnant.
I think no. They are laying eggs, so it's not pregnant, but it could be an egg retention.
And what's that?
Egg retention when they cannot lay the eggs. So the eggs will stuck into the fish.
Well, that's a huge problem
Yes.
even with koi.
Yes,
when they're
yes, yes.
when they didn't take out all the eggs, it can cause a lot of problems.
Yes. We should find the problem. What can cause this? There is maybe a husbandry problem, that the water quality is not good for egg laying, or what is the problem why they couldn't lay the eggs. But it could be another thing. It could be a bacterial infection also, which
Can that cause inflation in
yes,
the belly?
of course. So it needs some further investigation.
Nick has sent us the German blue ram. He has a weird bump on face. Some oil extract medication helped a bit, but it made the water very cloudy. Oil extract medication, what's that?
I don't know. It's a good question. What kind of oil? What kind of medication?
Massage oil.
And maybe. And why? Why did Nick start with this? I think
Yeah, why?
I can tell you.
The blue and the green stuff. It helps.
Yeah.
That's a general thing.
So if it's alone, it could be a tumor. If it's not alone, if it's with other fish, then maybe it's a fight injury. And because if it's an injury, as I told you, open gate for the bacteria. Red phantom tetra.
Yeah, so he has white spots on the body, and I think that this is going to be an easy answer, right? Because
Yes.
this is one of the most common diseases that we see.
Yeah, I think so. So it's Ich. It came from the scientific name, which is Ichthyophthirius multifiliis.
Yeah, white
So,
spots.
Yeah, I think the most common is the white spot, and the disease called white spot disease. So
And this is a parasite, right?
yes, it's a parasite. It's a ciliate. You can see the white spots on the fish, but if you do a skin scraping, you can see this under the microscope. Let's see the picture under the microscope.
Oh yeah, let's check out the picture.
So if you check under the microscope, you will see this horseshoe-shaped micronucleus, which is...
What's that?
I don't want to explain this to you because...
We don't have enough time. We will be here until tomorrow.
Yeah, so this micronucleus, it's very easy to see. And after this, you have the diagnosis. But I will show you some other things. Mostly the people think that this guy is an external parasite, but no, it's an internal parasite, and you can see on this picture.
These are the geos?
Yes.
I can recognize them
yes,
already?
because these parasites usually infect the skin and the gills also.
And why are you saying that these are internal?
Because you will see here, this is the parasite,
Okay.
and these are the cell layer around the parasite.
So
And-
we actually have one thin layer of
Yes.
cell around the parasite. which means that this guy is inside the
Yes,
gel,
and
not
it's an
on the
internal
outside
parasite.
of the gel.
Yes. So if you start a cure, you will not kill these guys, you will kill the free swimming stages. These guys will develop, these guys will have free swimming stages,
Okay.
and after you will kill that also.
So you need a couple of stages of treatment. So
Yeah.
first you treat the ones that are free swimming, and then you wait how long?
It's depending on the water temperature. This is the reason why the aquarists say, okay, go up with the temperature.
Because they will be released quicker.
Yes.
Before we move on, I have to tell you that this one, the white spot, is one of the most common diseases that we see in the aquarium hobby. And this is what Lori, our fish expert, has also told us, that he sees this not a lot, but most often when we have like a bad shipment of fish, he sees this for most of the time. And then he's able to cure this quite successfully with medicine. So it's not something that cannot, it will not persist.
With white spots, it's very easy because you will see the spots. These spots are usually half or 1.5 millimeter big, so it's easy. But other parasites, it's invisible. Only microscope could help.
And you can only see that there's a problem by looking at the fish, the behavior of the
Yes.
fish. Yeah, because we tend to forget this, actually. We're so much into aquascaping and into creating an ecosystem that we kind of forget that we are responsible for small creatures, small living creatures that live in aquariums. So we need to take care of them, right?
Yes, because if you not do this, maybe it will be too late.
It will be too late. New diseases will start to appear, and then you will not know what the problem is. All right, so the next picture comes from Luke. The Pleco has a lump on her back, and it's a 4-month-old lump, and the appetite and behavior is normal. So what do you think that is?
Maybe again a papilloma. It could be because it's a bump
Is
there.
that quite a frequent common thing?
Yeah, it is. Because as I told you, viruses can cause this, papilloma viruses, and also it can came after an injury.
Okay, Gabor has sent us, this is a Hungarian fish. It doesn't look very good.
Yeah, it's a very bad
The
shape.
celestial pearl Daniel looks very, very bad. I'm surprised that it lives, actually. Euthanasia, is it okay to put the fish in 0% water? Okay, so we have two problems. The first one would be what's the disease of this fish, and the second would be what to do when you think that you can no longer help the fish.
Okay, so start with the dropsy. This fish is in very bad shape.
Okay.
So, and Gabor told to us that every fish got this disease in the tank. I think there is a big problem with the tank because this disease caused by facultative pathogen bacteria. So these bacteria are everywhere, in the waters, in the nature, everywhere. But when the
fish will only get it when there's a stress factor somewhere.
a stress or bad water quality, or not enough good nutrition or something, or maybe there is a parasite in the background. It could be. And then after this, after the primary point, the secondary
addressed.
Infection will come.
So you need to address first the husbandry problems, and then you can check out to see whether we have any parasites.
So Gabor, you should figure out what is the primary problem, and after you will have healthy fish. And the second question, the euthanasia. It's a hard question. So at home you can buy some medication which could help to euthanize the fish. To put in the fridge or the freezer, it's not the most human. They feel also pain, as we.
Okay, so where do you get that medication, and how do you decide whether you want to euthanize your fish or not?
So usually I talk to the pet owners or aquarists, and that the animal has not the optimal or not the good life quality, then and they are really sick, so they stop to eat, they are weak, they are
you see that they're in the final stages.
Then it's time to euthanasia.
And then they can contact you, and you would be able to ship them some medicine that would do the job.
But if somebody couldn't order this, It's a hard question.
Yeah, I'm sure that you can find a vet locally, and,
Yes.
and the local vet would help you if you don't want to contact Marton, which I would strongly suggest, because he can send it to you if you live in Europe. He can send to you any medication that is needed after consulting, obviously.
Yeah, yeah. Maybe we can help, but in this stage, it's really hard.
Kevin, the green neon tetra has a fuzzy mouth. Yes, I can tell. He did white spot bacterial treatment and it helped, but the mouth got swollen again after some time.
I think it's again a papilloma. Maybe there were
Which is a problem there, because the fish cannot feed very well.
yes, yes, and it will be weak and the fish will die. I think the other thing before this papilloma was also a papilloma, but if it's growing, then this papilloma will be necrotic, so the cells will die and fall just down. And it will grow again because the papilloma virus are in the fish. So
you're saying that the white spot treatment was not the proper treatment,
No.
probably.
maybe there was
There
some
was
white
some
spot,
white spot as well.
or
Who
a
knows?
bacterial infection also, but I think this is papilloma or another tumor.
Okay, so again, guys, don't jump to conclusions, please. Don't jump to conclusions, because if you do, you're not a vet. You have no idea what's happening with your fish, and as we can see, there's so many things that can happen to a fish that needs professional care.
Yeah, as I told you at the beginning, it's just a differential diagnose, and it need more
More questions,
yeah,
more
more
answers,
investigations
more
to
investigation.
find the proper diagnose. And after the proper diagnose, you can treat your animals.
I get it. Okay, let's move on. Next one comes from Just. Otocinclus affinis has white spots on skin and pale color. So what do you make of this picture?
It's not a typical white spot, so it's not the white spot disease. This fish is in bad condition. I think the husbandry is not correct, or another fish insult this animal maybe, because I think it's come also from the stress and stressful situation, or from the bad water quality.
And also these little fish, the Otocinclus affinis, have more problems adjusting to the conditions in the aquarium than other fish would. Once they get into the tank, we tend to lose many of them. But after that, when they're stable in the tank and they actually get through that stress factor, they're fine. They're the last fish to lose in the tank. They're so hardy after some time. But at the beginning, we tend to lose them a lot.
Yeah, so check your water quality, check the husbandry, and the feeding also, and maybe you will find a primary problem there.
Okay, so the next one is from Furkan. The black tiger dario has an extremely swollen eye. Is this the Popeye?
The Popeye caused by bacteria. But this fish, as Furkan said, eats and behaves normally. So if it's the beginning of the disease, yeah, it could be a Popeye. Later stages, the animal will stop to eat and the others and will be lethargic if it's a bacterial. But it could be other thing also.
What?
So it could be fat deposition behind the eyes.
Oh, really?
Yeah.
And why would that come?
Because they are overfeed maybe. It could be also, or it could be also neoplasia behind the eyes.
What's that?
It's a tumor, the neoplasia.
But that
and
would grow fast, right?
depending. If it's a malignant tumor, yeah. If it's a benign tumor, no. If the animal will behave and eat normally in the future also, it's not a problem. Maybe just a fat depot there.
What can you do with that? Nothing.
Nothing. Maybe check the feeding. Maybe these animals need less.
Again, general conditions.
Yes. But if the animal will be lethargic, and this will be the sign of bacterial disease, for example.
Eric has sent us this goldfish which has a swim bladder disease. Is that a disease?
The swim bladder disease, yeah, it could be. It's a bacterial infection. Again, if the animal has a swim bladder disease, but in this case, you will find your fish at the bottom of the tank because the animal cannot swim up.
Yeah, it says that it's sinking down.
Yeah, it could be. So in this case, also you have to consult a vet, find a proper antibiotic and start the treatment. There is another type, not in this case, but most of the aquarists think it's also a swim bladder disease when the animal is floating.
Oh, so it matters whether it goes down or whether it goes
Yeah,
up.
it's not the same. If they are going up, it's a gastrointestinal disease. Gas are forming in the belly.
And then the gas
Yeah.
will send them up.
Then you should stop to feed your animal for 1 or 2 weeks. They will not die, so
Okay.
because you stop to feed. But the intestine will be also again normally.
Is it okay if you don't feed the fish for at least 1 or 2 weeks when you go on vacation, for example, in the summer? What's your take on that?
It's depending on the animal. What kind of fish is that?
Like regular aquarium fish, tetras, whatever, guppies.
1
What
week
would you
is,
think
I
about
think
it?
I think 1 week is not a problem. If you go to vacation for 2 weeks, maybe you
Ask
have
somebody to help.
or buy an automatic feeder. One more things for this, as I told you, it could be a bacterial infection, and it can also be, if it's a female, it could be egg retention also, because the eggs can just make a torsion of the swim bladder.
Really?
Yeah, and it will go in
Like
another shape.
they push
Yes,
it?
yes, they push it. So the swim bladder will go in another position, and then it will be a swimming problem for the fish.
Let's check Szilárd, also Hungarian guy, black neon tetra, mouth infection, maybe thrush.
I think it's just a wound. It could be a fungal infection also, because there is a wound and the water mold.
Gate is open.
Yeah, it could infect the fish, but from one picture it's very hard to say. If I have no further information, I will put this fish into the quarantine tank and check what's happening.
Is this generally a good idea when you see a sick fish, put it in quarantine, not leave it with the others because you don't know what's happening?
Yes, and you can treat that quarantine tank, because maybe you don't
Want to treat everybody else.
the whole main
So
tank.
how do you decide whether you want to treat the whole tank or you want to treat, because if you have parasites, maybe there are other
Yes.
fish.
Correct. So it's depending on the type of the disease. If you put your fish into the quarantine tank and it's a parasitic disease, you treat in the quarantine tank that fish, but the parasites are on the other fish also.
So you introduce it back on and it will get it again.
The same. So you have to treat the whole tank. If it's, as you told, a bacterial infection and it's only on one fish, not on the whole population or on the whole group, then just put to the quarantine tank, start with antibiotic medication.
Okay, so generally it's a good idea to have a quarantine tank anyway.
Yeah, it's an empty tank, a small one, and you can treat very easily in it. David has also sent us a picture about a ram, and it could be also problem with the husbandry, also could be a tumor. It needs further investigation.
Christians with the beta, white spots, mostly around the head.
It could be also bad condition of the water, filtration problem, but it could be parasite also. It need a microscopic investigation,
They
skin
never
scraping,
manage.
yeah.
I say beta, no information.
But it's an interesting case. You can see the opercula of the fish.
What's opercula?
Opercula is the part which covers the gills.
Ah, I see.
There is a deformation on the opercula. If you check the picture, the opercula is in other position, like this.
Yes, standing out.
Yes, and it's a nutritional problem.
Is it?
Yes, it is. It's vitamin C deficiency.
Like scorbutt.
Yes, it's the same. The fish can also have scorbutt.
Can you actually feed vitamin C to the fish?
You can put the vitamin C on the pellet. Just spray with the vitamin C solution.
So that can be dissolved in water?
Yes, of course.
So you dissolve it in water,
And just
spray the fish food with it, and then add that fish food.
Yeah, wait some minutes or hours
Until it dries out
yes,
and it gets
yes,
into
yes,
that.
Yes, yes.
Asier, a neon dwarf rainbow fish, fast breathing, pink grains in and body death in a week. So that fish is no longer with us. What do you make of this?
It's an interesting case also. First, the owner should check the water, the oxygen level, because it can cause heavy breathing.
Okay, so if the oxygen level is reduced, then you might have a problem.
Yes, of
For
course.
example, if the water temperature goes up, then the oxygen can be drawn out of the water more easily, and then even if you have the same conditions but the temperature goes up, then the oxygen level can go down, and then you can have problems.
Yeah. The second, you should ask a vet to check the gills under microscope, because it could be parasite.
And then it's obstructing the oxygen intake in
Yes.
the gills.
Yes, it could.
How would you take a sample out of that? Because I've seen how you take a sample out of the koi fish, which is a huge fish, and you just take a tool, a plier, whatever, and
Yeah.
you just take a little piece out of it. But with small fish like this, how can you take a sample from the gill?
We can take also a biopsy from the small fish with smaller instruments.
Oh, I see. Okay.
That's all. So, nothing a big magic.
Okay. Angelica, the amber tetra, swollen abdomen and gray areas.
Again, I think it's problem with the water quality, with the husbandry, because it could be a bacterial infection again.
I see an internal filter there in the background, which is
Yeah.
already the filtration problem that we mentioned at the beginning of this
And
video.
if this is the only filtration, yeah, it could be also. We don't know nothing about the other animals in the tank. Maybe it's overpopulated.
Alicia sends us a goldfish which has a lump at the back of his tail.
It's again an interesting case. It could
Is it?
be. Yeah, it is.
Right. For me, it looks like the other one. Just
it's
it's
an
a
interesting
papilloma.
case. No. Not
I
again.
will not be a vet. Not
again.
again. Okay, so tell me about it.
It could be a tumor, but not a papilloma, because it's a lump there. So, if a vet will take a biopsy after the histopathological investigation, can tell what kind of tumor, if it's a tumor. It could be a bacterial infection. For example, there was a small wound, and a local bacterial infection can start there. And the third one, it could be again vitamin C deficiency.
There.
Because yes,
Like that.
as you told, the scorbut, and if they not eat enough vitamin C, and they will have broken bones. They could.
Sure.
Yeah. So it could be a small broken bone, and as in other animal, there will be an edema around the broken bone, and it could be this.
Okay, Alex, for the beta bulge on head.
It could be a bacterial infection, because betas and tetras are really sensitive for the mycobacteria.
What's a mycobacteria?
Mycobacteria is a bacteria species. Mycobacteria are living everywhere around the world. They can cause human disease, also animal diseases, and fish disease also. So Mycobacteria marinum and fortuitum can infect the betas and also black tetras, and they are really sensitive. And
Like phantom tetras?
Yes. And in the first stages, you will see nothing. Later stages, you will see bulges, maybe,
Right.
and the animals will die.
And how would you tell that this is this and not another disease?
Of course, investigation. In this case, we need histopathological investigation.
Why would you say that this is this? Because of the beta?
Yes, it could be other, but it could be also a tumor and other things. But I start with this because it could be a zoonotic disease. So it can infect humans also.
How?
If you have a small injury in your hand and you do something
Trim
in
the
the
plants?
tank, yeah, for example, or put a new plant or a rock or something, or you just clean the aquarium, and this bacteria can infect you through your wounds.
And what happens to me then?
Then you will survive. You just
I almost stopped the hobby. I almost, like half an hour with this guy and I'm becoming hypochondriac. I already feel a fever. I made a trimming last night.
so you have to consult with your human doctor, And after the symptoms, you will,
What symptoms would I have?
symptoms you will have skin problems like red area
Like
on your skin.
rashes?
Yes,
or-
yes, yes, yes. And after the proper antibiotic treatment, it will disappear.
But you need to tell your doctor that you got this from a fish.
Yes.
Because the doctor would probably think something else, right?
Yeah, it could be, because first the doctors think it's a injury or a fungal infection, for example. They will start the treatment and it will not help. And after, maybe...
So you start to treat bacteria for fungus, which is not okay,
Yeah,
because it's
yeah.
not going to help. You need antibiotics.
Yes. There are some other disease which are zoonotic. For example,
Okay, so
parasitic disease.
stop. What is zoonotic? Zoonotic means that it can jump between
Yes.
species?
So this disease, the zoonotic disease, can jump from an animal to a human.
Okay, so what are the fish-human zoonotic diseases?
For example, the Mycobacterium. There are some parasitic zoonotic disease also. It's a huge list, so but usually,
Don't.
but
Well, I did this hobby for 12 years. I didn't catch anything by my knowledge, or it was treated badly.
no, usually it came from white-caged animals. You are a lucky man, still alive, so
Okay, should I be afraid or not? Because people are gonna comment.
no.
No, so I'm gonna survive this hobby.
Yeah.
Okay, but be careful and not hurt your hands. For example, people were asking me, why do I wear gloves while I'm handling the rocks and etc. It's because I don't want any wounds on my hands. That was before I talked to this guy here. But I naturally knew that it would not be good for me to have wounds and water together. Are not going well anyway.
So in this case, if it's a mycobacteriosis on the fish, you cannot do anything. There is no treatment. You should be sure that it's mycobacteriosis after the vet investigation. Then you should euthanize the animal and clean the whole tank. So if you do nothing,
don't keep the plants.
yeah. So if you just put out the fish and you will put in new fish, then they will get also mycobacteriosis.
So you need to disinfect everything.
Yes.
So not keep any soil. You can the hardscape can be actually disinfected.
So you have to restart the whole aquarium.
All right, so let's move on to some specific examples of fish diseases. I've got the tail and fin rot on my list here, written by Lori, our fish expert, which is a bacterial infection. The fin edges are fringed, they die off.
It's a common disease. It also starts with a primary problem, husbandry and other things, or with an injury. Bacteria from the water, so facultative pathogen bacteria, will infect the animal.
Oh, I see.
And after the antibiotic treatment, the animal will heal very, very good.
I see. Okay, and then we have the mouth fungus, which is also bacterial, caused by the Flaviobacteria, whitish or grayish spots on the head and around fins.
Common name is the columnaris disease, and as you told, that is caused by Flavobacteria, and the bacteria are growing on the skin, in the mucus, and when I just do a skin scraping, I will see under the microscope like column-shaped structures. These
Very
will be the
interesting.
bacteria. So here again, proper diagnose, and after that an antibiotic treatment will help.
As with all bacteria.
Yeah, but as I told in the previous time, you should do an antibiogram to find the proper antibiotic. Because
see.
if you just put the antibiotic into the water, then the bacterial resistance will grow, and we will have problem in the future. Not only in the animals, also in the hospitals with us.
Let's just continue very quickly. The saprolegnia fungus, white cotton-like formation on the skin with long threads.
Yeah, these are the signs of this fungal infection. Again, it needs a primary problem. In this case, in the fungal infection, a wound is the primary problem.
That's when it attacks.
Yeah, there the spores of the fungus will stuck, and the fungus will start to grow.
Right.
And the hiphas of the fungus will grow and grow, and the tissue will not get enough oxygen.
Right.
And they will
It'll
die.
off.
Yes, and the fungus will eat this dead tissue.
So you have medication specially for fungal infections,
yeah,
right?
yeah. Usually the medicines which contain malahit green is the best. So you can use malahit green medication in the hobby, but no in the aquaculture.
Why not?
Because it's forbidden.
Oh, I see.
Yeah,
Okay.
because this malahit green could harm you if you eat this from the fish.
Oh, I see. So not for human consumption. While we're here, I wanted to ask you, what kind of treatments and solutions do you recommend for the everyday hobbyists without consultation? So is there anything that we can do to treat the fish without consultation? And I want to avoid the green water, blue water mixture style.
There are some diseases which have special signs, like the white spot. But the others, maybe the fungal infection also.
You can see the fungus.
Yeah,
it doesn't look like anything else.
Yeah,
so.
Because you will see this whitish cotton-like stuff on the fish.
What happens if the fish gets injured and you want to treat the injury itself? Because you see that there's an injury and not caused by something else. Can you treat that injury?
Yes, if you have the best condition in the aquarium, it will heal very, very quick.
The anchor worm, which is a parasite, obviously, white-shaped formations, deep and fast. It's like it attaches to the skin.
The English name is anchorworm, but it's not a worm.
What is it?
It's a crustacean.
Oh, is it now?
Yeah, it is. So it attached to the skin. The head of the parasite will be inside in the fish, in the meat of the fish, under the skin, and only the females are parasitic. If you see these parasites on your fish, you have to remove by hand. Also,
With a tweezer.
yeah. For example, it's
Can you?
Yes,
Like the head
you
will
can.
not get stuck in?
No, you can very easily. And if
Oh,
it's
cool.
stuck, then there will be a small inflammation, and after
It rejects.
Yes,
The
yes,
body
yes,
rejects
yes.
it.
So, if you have this problem, you have to treat the whole tank, pond where you have this problem, and also to remove these parasites.
Okay, and then we have something that is not really a disease, but we do sometimes toxicate our fish with CO2. The high levels of CO2 would cause increased oxygen need, and the fish will gasp for oxygen at the top of the tank. That's the first sign. But that is actually caused by CO2. So be careful with the CO2. If we're talking about the health of our fish in this video, I just wanted to mention that CO2 is something that you can toxicate the fish with if you have too much of it.
If you have the proper instruments, you can check the CO2 level, and the 20-35 ppm is toxic already. But you should check, maybe it's not an oxygen problem, it could be a parasitic problem and others also, or...
Because then fish will go up?
Yeah,
also?
again, yeah.
Well, at the end, I just want to thank you so much for being here with us. And I want to tell you guys that if you want to contact Marton here, he's ready to get your pictures and he's ready to ask you questions. You will find him at the vetforfish.com. There, I'm going to link his website in the description, and his email address is vetforfish@gmail.com. So drop him an email, but don't expect him, please, to service you, to help you for free. He will charge a small fee. You will discuss with him the prices on email, and it's going to probably appear on his website by the time that we release this video. So please contact him. He's ready to send you actually medicine. So he's licensed to prescribe medicine for fish, so he can send it to all European countries basically. So this is not a service for free, but you're going to get the professional help that we also get from him, because he sometimes comes and checks the green aqua fish and the fish room. He will consult with Lori as well to see what he can do about the freshly arrived fish here at Green Aqua.
Yeah, I will do my best.
So thanks so much again for being here with us.
Thank you for this
You're a
opportunity.
great guy, and thanks for helping all the hobbyists
Thank you.
throughout the world. All right, guys, don't forget to subscribe to the Green Aqua YouTube channel if you didn't do so yet. And we'll see you next week. Hit that bell button to get notified of future uploads. We have a membership. Goodbye.